Hi, I'm Dan Pollyea from the University of Colorado, and here to discuss a little bit more our session at the SOHO meeting regarding how Venetoclax has changed the clinical treatment paradigm for patients with acute myeloid leukemia. We now have randomized phase 3 data comparing Venetoclax plus azacitidine to azacitidine alone as the upfront treatment strategy for older or unfit newly diagnosed AML patients. And I think we're all very happy with these results. The study met the primary endpoint for survival. There was a significant improvement with respect to response rates as well for patients who were treated with Venetoclax. And I think this really enshrines this regimen as the standard of care for patients in this category. So once again, older, unfit for intensive chemotherapy, newly diagnosed AML patients. And as we discussed, I think there are other areas in which Venetoclax will and already is having an impact on patients with AML. In the relapse and refractory setting, although not a labeled indication, many of us use this off-label, and this has been incorporated into the NCCN guidelines as a suggested therapy for patients in that setting. Similarly, I think many of us are starting to consider whether some patients who might be candidates for intensive chemotherapy based on age or comorbidities might be better served to receive a Venetoclax-based regimen, perhaps because of disease-related features. So some patients with poor prognostic risk factors for response to intensive chemotherapy, while they may be candidates for intensive chemotherapy based on, again, age or comorbidities, perhaps should be given or considered to be given another regimen that may work better for patients with that disease biology. So lots and lots of interesting directions that this can and will take, and very exciting time to be involved in the field of AML. Thanks so much.